he was hit on his head, okay, and he was unconscious for a while. And then 911 was called and he was taken in the ambulance and he was admitted. Okay. After some time, he regained his consciousness and immediate CT scan was done in the hospital, which showed intracerebral hemorrhage. Okay. Then the patient was admitted, he was treated, and he was discharged. Okay. So this is the case you're getting. I have given you a complete case so that it is easy for us to discuss today. So we have medical history, we have the concomitant medication, and we also have the clinical scenario which happened around the adverse event. So the adverse event here is the cerebral hemorrhage. Okay. So now, based on this, how do we assess causality? Okay. So I'm thinking like I have to say whether our company suspect drug is causing this adverse event or not. But if you see the medical history, he is a diabetic hypertensive as well as ischemic heart disease. And now the event is cerebral hemorrhage. Okay. So he is hypertensive. So there could be some shoot up of BP, which blood pressure, which could have caused his cerebral hemorrhage. Okay. Or he was on the concomitant medication of aspirin, which is antiplatelet, which can cause bleeding even with trivial injury. Okay, which could have happened uh, for this patient. Now, how do we rule out that this shoot up of BP had or had not caused his cerebral hemorrhage? So now, if we have any documentation of his admission, like discharge summary or any medical record, we can ask the site or the investigator or the patient to provide the medical record. So if we get the medical record, we can go over all the vital signs, the parameters when he was admitted, and what was the cause the physician has attributed for this cerebral hemorrhage. We can go over and we can see if the blood pressure is normal, then it is going to be the antiplatelet which has caused hemorrhage due to this trivial injury or fall. Okay. So now, based on this evidence, okay, we have this evidence and we also have the discharge summary, the medical record, which says his BP is normal and he is on antiplatelets. So based on this, I can attribute that this intracranial hemorrhage, cerebral hemorrhage, which the patient had experienced, is not due to our suspect drug, because it could be due to the concomitant medication the patient or the subject was taking at the time of the event. That is the antiplatelet medication of aspirin. So now I deem this suspect drug is not related to the adverse event of cerebral hemorrhage. Okay, so this is how we practically approach the causality assessment. Okay, so we go with the concomitant medication, past medical history, clinical scenario, and also we look for the previous cases, like was this suspect drug crossing similar kinds of adverse event or not. Okay, so there are also other scales of causality assessment. The first one is WHO causality assessment, which is most commonly used. The other scale is Naranjo scale, then Ailes algorithm, Bradford Hell criteria, which is for pharmacoepidemiology studies. You might be asked sometimes about the scale in the interview, so just know names of these scales, which is used for causality assessment. Okay, now getting into WHO scale. Okay, so I told you we assess mostly as related and not related, but some companies assess, they have little bit gray area like certain, probable, possible, unlikely, conditional, unaccessible, and all that. Okay, so we will, in that case, which means they are using WHO scale, and we will see how we assess this certain.